Welcome to the College of Complexes. This is our 427th meeting since we started in February of 2009. We put a speaker on every week, a different subject. We require a speaker to take a position on an issue or express a point of view that be for or against something. We don't care what it is. We give them an hour to make a presentation. If they go over an hour, we cut them off. If anybody interrupts the speaker, we remind the interrupter we listen only one fool at a time. Then we have questions and answers from the audience of the speaker, not speeches. Then we have remarks, rebuttals. Everybody in this audience that wants to gets 5 minutes at the podium to respond to the speaker said for or against. And our speaker gets the last word, gets comment, a comment, close the meeting. That's how it works. But before we introduce our speaker, we have time for announcements. Anybody have any announcements they want to make? Now's the time to do it.
I got one announcement.
Come on up here.
Philosophers Forum is going to start meeting on the 11th, which is next Tuesday at the El Phoenix at 9090 Skillman, right off of Skillman and Adelia. And the speaker is going to be talking about the metaphysics of Nazi anti-Semitism.
Wow.
Where it came from, why they do it, and why it was necessary in the Nazis' eyes to completely eliminate the Jewish race. So that might be a very interesting talk. Tuesday evening, 7:30 at the El Phoenix.
Any other announcements? Now's your chance.
Good fiery subject.
Anybody have any announcements? Zane, you got an announcement to make? Any announcements? I guess not. All right.
Cultural Center in Dallas, Latino Cultural Center.
Come on up
Their
here.
Day of the Dead is October 27th, Saturday. I got this earlier. That's it.
Okay. On September 15th, we have Fred Grinnell. He's going to talk about ethical issues in genetic medicine. It's on your itinerary. I won't read all this. And September 29th, it's about comfort women, victims of Japanese military's sexual slavery and uncorrected outrage with sex trafficking. And to this day, shouts for rectification. That's our speaker then. It's Seaman Pack, and she will be the speaker. It's on the itinerary. I'm not going to read all this. Our speaker tonight is going to talk about opposing privatization of foster care in Texas. Sarah Depew, she's a candidate for Texas House of Representatives District 67, which I understand is in Collin County. Is that right?
Oh, Collin County!
Anyway, she's going to discuss an overview of our state's foster care system and how it has fundamentally changed over the last 3 legislative sessions. She will describe its privatization and make a strong case for why this makes children in foster care less safe and what we can do about it. So without further ado, please give a very, very warm welcome to Sarah Depew. Up to an hour.
Thank you so much. Hi, I'm Sarah Depew, and as you mentioned, I'm running for the Texas House of Representatives in District 67. However, I've also been involved with the child welfare system for about 10 years now. I got my start there. First, let me back up. My master's degree is in psychology, so I worked in a cognitive science lab for a while, but I didn't really feel like I was making the kind of difference that I wanted. So I started working for the state of Texas as a conservatorship worker for Child Protective Services. And what that means is that I was the person that was assigned a legal foster care case. So when a child came into the system, they're assigned a caseworker, and I would work that case from start to finish. And that would mean working with the parents to try to identify, that would mean working with the parents to try to identify the risk factors of abuse and neglect that led us to that situation, and try to work with them to see what we can do to make it safe for the kids to go back home, monitor the kids' safety and their placement, make medical decisions on behalf of the child, be their educational advocate, and report to the court about the progress of the parents and the well-being of the kid, and make frequent recommendations. So I did that for about 5 years, and then after that I left because I was starting my own family. There's not really a way to do both. And I became a tutor for kids in foster care, and then I continued my advocacy by being a court-appointed special advocate for kids in foster care here in Collin County, which means that I was an independent member of the community to be the eyes and ears of the court to report back on how the case was going. And I've also gone through the training to be a foster adoptive parent twice. Long story, basically they won't let you do it if you're gossip. Anyhow, before I get started too much, I want to go ahead and give you an outline of what I'm going to talk about. I'm going to give you a brief overview of CPS itself, the lifespan of a case, because that's going to be important in understanding the different rollouts of privatization. And then I'm going to kind of talk about other states who have privatized their foster care system and what they've seen, the good, bad, and ugly, and what we've been doing. Is that too loud?
It's not loud enough
Huh?
for them.
Is it loud enough?
Oh, yeah.
Not.
Oh, not loud enough.
Yeah, so we've been, that's good.
Okay, can you hear me okay?
Yeah.
All right, then I'll come a little closer. I'm hearing a little bit of feedback, so I was just trying to keep anyone from being blasted. How's that?
Talking too fast for me.
Too fast?
Yes.
Okay. All right, how's that?
That's good. You're fine.
Bob, everybody is back okay?
Just go for it.
Okay, cool. Well, for those of you who couldn't hear me before, I was just giving a brief overview of my experience with the foster care system and giving you an outline of what I'm going to discuss. So I'm going to talk about the outline of a case, you know, kind of what its duration looks like, because that's going to be important in understanding the privatization. I'm going to talk about other states who've privatized and what that experience was like for them, and what we've been doing here in Texas and kind of how that's going and my concerns. And yes, I'm going to make the case that privatizing case management portion of foster care is a bad idea, and that I believe that it makes kids less safe and exposes them to potential constitutional violations. So before I continue too much further, I'd really like to just, if you have your phones, can I give you a number to program into it? Okay. For those of you who are interested, I want to give you the Texas Abuse Hotline. This is for only the most severe stuff. If you see something that needs immediate attention, you call 911. You can also call this number.
Yeah, I think that it might be one of the ranges, the high range and the mid range.
I'm going to try to move
Okay,
it high.
Tom, you need to point that speaker away.
This one?
Is it
No, the speaker is pointed towards the mic. You need to point it more towards the wall. Thank you. Let's try that.
All right, is that any better? Okay, we'll figure it out as we go.
Yes, we will.
All right, so for those of you who are interested in programming that number, it's 1-800-252-5400. And that is, again, for only really serious incidences that needs immediate attention. So the intakes that come into Child Protective Services come in one of two ways. They come in through that phone number, or they come in through there's a reporting website that you can go through and put in information. And so during that time, whenever an intake comes in, then the state is going to evaluate it and give it a designation. They're either going to say this sounds like nothing, we're just going to go ahead and dismiss this now, it's not going to go any further, or they're going to decide that, okay, this does warrant going into a little bit more. And so they'll decide it's either a priority 1 or a priority 2 investigation. And if it's a priority 1, then someone needs to go out there and see that child within 24 hours. If it's a priority 2, then it needs to be within 72 hours. We know in practice that doesn't really happen because that's actually physically impossible for a lot of investigators, depending on their workload. But that is something that we're always actively trying to improve, because obviously a timely response is important to a safe outcome. In 2017, the Texas Department of Family and Protective Services actually followed up with and recommended services for about 150 different families and children. They do that in 2 different ways. It's either family-based safety services, where they try to work with the kids while they're still at home. They say, okay, there is something going on here, but we'd like to try to work with the family as long as possible to make sure that we don't have to remove them. We want to go ahead and see if they can work their parenting classes, do their drug treatment, whatever it is they need. Let's do that while the kid is at home, and that is always preferred. In about 50,000 of those cases, though, they said, no, that's not going to be possible. We're going to go ahead and pick up the kid and put the kid in state custody. So that's the area that we're going to be talking about the most, is those 50,000 kids. That's the population that I worked with professionally. And so as of July 2018, here in Dallas County, there's 1,474 Dallas County kids that are in foster care, and in Collin County it's 173 kids. And fortunately, that's actually a really low number whenever you consider how much these populations have been growing. So, and in our entire region, so we have different, in Texas, we've split it up into 11 different regions, and these are massive geographical areas, right? Because Texas is a huge state, especially in South Texas. Some of these are hundreds of miles long, and the region that we're in is Region 3. And so in our region, there are 6,414 kids in CPS custody, and about half of those are placed with relatives, and the other half are in a licensed foster home. And there's more that are like in between. So I have more detailed information sheets if you're really curious about comparing the figures between 2018 and 2008 to see how those are changing as we've started this privatization process, but I'm not going to go into them right now. Just to give you an overview of the cost, not counting healthcare, just the actual case management and foster care payments and that sort of thing. This costs the state about $2 billion a year to manage. Could you hear me okay, Zen?
Yeah, I missed the number.
$2 billion.
$2 billion.
A year. Yes. So, if you would please, just for a moment, try to imagine yourself from the perspective of a child. They've experienced some kind of abuse or trauma that has led them to come into care, but the care itself is a type of trauma that needs to be avoided. And so, they've been picked up, they're placed with a stranger that they know nothing about, provided that this is a licensed home and not a relative care, but that's the example we're going to go with. And so they are now with this family that they know nothing about. They're driving in the car, and they don't know what town they're going to. Usually they don't know what the house looks like, how many people are going to be there. They don't know first thing about what their routine is. Everything they have is gone. It's very difficult for us as adults to imagine that type of powerlessness. But the things that they were really connected to, their dog maybe gave them comfort at home, but they're not taking their dog into foster care, or their toys that they liked, or their friend in school, or that teacher who was nice to them, or even the pillow that they liked, right? Even something as simple as sleeping on their own pillow is pretty comforting. And so they might have a few of their items, a few shirts, in a garbage bag usually, that they're carrying with them to this placement. And then they go and they sit down and they see adults do paperwork. They don't know what's become of their parents. They don't know when they're going to see their parents. They don't know how long they're going to be in this state, where they're going to be next week, next month, next year. Most of us as adults would have a very hard time coping with that, right?
Yeah.
They're going to a school where they know nothing about, everybody's new, and they're not particularly interested in you. Just even sleeping in that odd space is weird. And a lot of times there's not a whole lot of let's get to know you when you move in, right? It's placement paperwork, it's late, it's people have had long days at this point, they're ready to wrap this up. And so when you, as a child, are in that situation, you're not having a whole lot of, well, what kind of foods bring you comfort? Or there's really not a lot of that. And in my 10 years, I saw very few children get their own bedroom, even in that kind of setting. So if you've gone through a day like that child's gone through, most of us would want just some alone time, right? To get away from it all and to think and cry or whatever it is you do. That's not really what they have. What they have instead is they're sharing a room with other kids who are also living in hell and who are also going through their own chaos and their own trauma, and they've also experienced something awful to even get there. And so they're put in these small areas. You know, it can be anywhere. I've seen up to 6 beds in one room. That's unusual. Usually it's like, 2 or 3 beds, but still, it's a lot. It's a lot that we're putting these kids through. And so anything that we can do to reduce that trauma is a positive. I fully believe that all the legislative changes we've made have been towards that goal. We've just been missing the mark. So when I go through and I start talking about why I oppose foster care, privatization of foster care, I'm at no point going to be accusing lawmakers of greed or any kind of malicious intent in this. I don't believe that's there. I believe that people sincerely wanted to. I don't. I listen to the Senate hearings myself, and I genuinely believe they want to do what's right. It's just a tough situation, and I feel like they've missed the mark in doing what's right. I feel like they went the wrong way. So this last legislative session, we've done a few things. Some are good, some are bad. So I'm going to talk about the good first. We passed House Bill 4, which allocates about $350 a month to families caring for abused, neglected kids who are related to them. Because before, kids might, have an aunt or uncle who would want to take them in, but hey, they already have a few kids of their own, and they never budgeted to have more come in. They didn't expect that they were going to be taking in their brother's 3 other kids, right? That's tough. It puts families in a really difficult situation. And before, we had made it so that those funds were available if they jumped through extraordinary hoops and basically had to upend their life. So the legislature this last session did a great thing where they made those funds available without as many strings attached. So fortunately, fewer kids have to actually be placed in those licensed homes. They can be with a family member that they at least know, and there's something to that.
Good.
There's also House Bill 5, which makes the Department of Family and Protective Services a standalone agency, so it's no longer going to be under Texas Health and Human Services Commission. Okay, that's fine. I don't have big feelings about that one. We also passed Senate Bill 11, which is what we're going to be spending most of our time talking about, which authorizes the state to create community-based care models for providing foster care, which is fine, except for we're now going to be handing all those responsibilities over to private agencies and private companies, and that's where I'm going to have a problem. So Texas is not alone in this. Other states have also tried to privatize foster care. We've seen that Kansas, Florida, and Nebraska have privatized it either partially or completely. So we're going to go ahead and go through how that worked out for those different states. Kansas had, mixed results. They fared better than the other two. But one thing we saw is that the public employees didn't transfer over to the agencies. One assumption that you'll see time and time again that Texas has made and all these other states have made is they assume that whenever you privatize foster care, that all those caseworkers who worked for the state are just going to go over and jump ship and go work for these private agencies. And that's not real life, right? They're not going to be, working those kind of hours, those kind of caseloads, and have pension and be vested and have benefits on the state side, and then go make less and not have any of those benefits on the private side. Like they're not interested. Right. And so they have to totally re-staff up each time you privatize. And that creates a real lag in services. It's much more costly than the agencies really anticipate. They don't really think about that. They think it's just, they're going to go from here to here and it's all going to be fine. And that's just not so. New employees were expensive to train and had even higher turnover than you saw with the state. Because every foster care agency, every foster care system within a state always has high turnover. That's just the nature of the job. It's a very stressful job. But whenever you get paid less and still have those same workloads, it increases. And when you're new at it and you don't have that kind of structural support and people who've been there for a long time who can train you and help you, and everybody's new, people bail really fast. The other thing is that whenever these states privatize, they keep investigations, the people who are actually investigating the child abuse, very separate from the people who are actually working the cases. And that's a big problem because it means that people investigations they kind of maybe lose a little bit of respect for what that removal looks like for the child long term. And so in every state where we've seen privatization happen, we've also seen the rate of removals increase, not decrease. So in Kansas, they actually saw a 20% increase, and we'll see, I think, another state actually quadrupled their removals. So over time and after substantial infusion of money, because this always costs a lot more than the states and these agencies think it will, states always have to bail them out. They always have to pour way more money into these private companies than they would have if they just managed those services themselves. So it's substantially more expensive. But after the Kansas legislature just went ahead and poured in about a third more money than they were already spending, they saw some modest improvements. And those are good, right? Anything positive is good. They saw that, unfortunately though, whenever it would come time to renegotiate those contracts, nobody else could take those contracts over. Nobody else could absorb those responsibilities. And so what they saw is that there was no actual competition, and the standards outlined in those contracts were really more like guidelines. These were goals, because if you weren't going to meet them, what are you going to do? You don't really have a whole lot of options. So it's important to know that privatization does not actually drive market competition. There is not enough competition for these types of contracts for that to be a reality. There just isn't. One real positive in Kansas, though, was that they did get improved data. They had stricter guidelines for what kind of measures they had to keep track of, and because of that, they were able to see what types of disabilities they were getting and anticipate care a little bit better. So there was some positive, but on the whole, it was very expensive and had more contract instability than they were expecting. Oh, you hear music? Nebraska. Well, one thing to note is that in all of these cases where we privatize foster care, you break up the state into different regions and you award a contract in each of those regions. And so Nebraska tried that as well, where they broke everything up into different regions. And you always start off with, okay, we're going to let you privatize the services. And then you privatize the placements. And then you privatize the whole shebang, the casework and everything. And in Nebraska, only 2 regions in the entire state were able to get half of those off the ground. The others tried and then just totally dissolved and fell apart. And so the state has to continue to manage those, even though they had legislatively privatized them. They have nobody who can absorb those responsibilities. And in the 2 regions that actually did take off a little bit, where they privatized the services and placement, one of them even fell apart even after 14 months, and the state had to re-go in and reestablish its own ability to do that service.
It was Nebraska?
Yes, in Nebraska. So there's actually now only 1 region in Nebraska that's actually privatized, and the state's had to abandon all of their efforts. A second region started being privatized, but then had to pull out of its contract. And the biggest issues they saw were loss of workers, like we talked about before, contract unpredictability, interruptions and losses in service and stability, and issues with monitoring and accountability. And the accountability issue and monitoring is an issue that no privatized state has been able to resolve. No one's been able to develop a system for actually monitoring these private companies and seeing how they're doing and holding them to account. And we'll also get into a little bit later about how that becomes a problem in the court system. So Nebraska is a little bit different than Texas in that Nebraska tried to just privatize everything all at once, and we've not tried to do that in Texas. We've been doing it in stages, and it's been a very slow rollout where they tried to just boom, do it over 2 years. And that really destabilized it even more so than it would here in Texas. So one thing on foster care is that usually how it's paid for is that the state pays a daily per diem for each day that the child is in foster care. They pay that out to the agency, and they keep some of that for overhead and case management, and the rest of it they give out to the foster parent. And so whenever we privatize foster care, they often try to totally undo that model, and they want to say, okay, let's cap how much we want to spend on this particular service. And so that way we know how much in our budget to expect it to cost. And so we're going to go ahead and give this company a blanket, a fixed amount of money and expect them to do all these services for that amount. And that has never worked, not once. So one thing that really did was, well, it just cost more than they expected to. You have a situation where then the state has a choice of either, hey, we're just going to go ahead and give you a lot more than we said we were going to, or you're just going to have to collapse. Like, those are the only 2 options at that point. You either have to let the system fail, or you have to bail it out. And usually how they said what they're going to give those private companies is they give those companies whatever it was that they were paying already. Like, this is what it cost us to do this, and so this is what we're going to give you. This is our average. So we actually tried something very similar in Texas. We've already abandoned it, thank goodness, where we basically were like, okay, the average amount of time that a kid stays in care is X amount of months. This is the average that we pay for that kid. Here you go. This is what you get for that child to provide foster care for them. And if the kid goes home early, great, you get to keep the difference. And if they stay longer, you get to eat the difference.
Wow.
Yeah. That was actually what got me first interested in this. I was still a caseworker when they tried to roll that out, and I was bored. Because the barriers to kids going home are not because of a financial incentive, it's because drug treatment takes how long it takes, or like those barriers are there regardless of how much money somebody's getting. No one is leaving a kid on their caseload because, oh, I'm just not incentivized. It doesn't work like that. And so what they found whenever they paid families like that is that kids, sure, they went home a lot sooner, they went home a lot more often, they also came back into the system a lot more. And we do not want that. You don't want a kid being a repeat customer for some of these agencies. You don't want them leaving and going home and then having to go through that removal process again. That is the, anyhow. A guardian ad litem, which is, someone who's, I talked about being CASA here in Texas. CASA is often the guardian ad litem, the person who's speaking for the well-being of the child, their legal best interest in the court. And so a guardian ad litem in Lincoln, Nebraska, was quoted as saying, "I think it's ridiculous to call it reform when we're really doing the exact same thing just with different people. That's not reform, it's just a burden shift." And I think that's a really important point because a lot of times this privatization effort happens after litigation that says, hey, your system's broken, it needs to be dealt with. And this is what the legislators has kind of come up with is, washing their hands of it. And so that's not an actual reform. In fact, there's really very little that has been done in reform that can't be done in the public model. So Nebraska's child welfare system is now, 60% publicly managed, 40% privately managed, and that 40% that's privately managed is still all in that one region. It just happens to have a lot of removals. So Florida also took a crack at privatizing foster care, and it looked more like what Texas is doing. They chose a community-based care model where an already existing agency is awarded the contract and they subcontract it out to other existing agencies that are already in the region. And they did this over a very long transition period, over 7 to 9 years, and that's kind of what we've been doing. We've been dragging this thing out for closer to 11 years now. They also awarded a specific amount of money to the agency for the entire contract time, and they're asked to complete the responsibilities with that amount of money. However, in 3 years, their caseloads quadrupled. And so, like every other example of privatization, the costs were far greater than anticipated, and the state did not give them additional funds and just let several of the contracts just collapse. It was also found that there was a lack of accountability between the state contractor and their subcontractors, because once you get that many stages and steps removed from any type of oversight to services, you're going to have some abuses happen in there. And again, they found that children were reunited with their parents at a higher rate, but they also re-entered the system at a higher rate. And during that time, Florida transitioned to privatization. 500 children lost their lives due to maltreatment.
Oh my goodness.
What year?
That was for that range. That was for that 9-year period that they were transitioning. And so, unfortunately, even with that kind of death count, I can't say that Florida is doing worse than Texas. It's not. Texas holds the distinction of having more children die in its state for maltreatment than any other state, and we have for a very long time. It's not a fluke. It's not a thing that just kind of, we have a spike. No, it's been this way for over a decade, and we also happen to spend less on preventive services to try to keep things from getting that out of control than most other states as well. So anyhow, kind of getting back to Florida a little bit, whenever they were looking at how to privatize, they knew, again, they had litigation that wasn't going well for them. They knew we needed to really revamp this whole system, and so they created 5 different pilot studies across the state, and they picked the one that had the best outcomes. Actually, 4 of the 5 totally collapsed, so they picked the only one that didn't collapse. But region matters when you're doing your pilot study, and what happens in one area is not necessarily, you can't expect those results throughout the whole state. And so the pilot study out of Sarasota was the one they went with, which is very similar to what we're doing, which is, again, that community-based care. But they found was whenever they stretched that out over the state, they didn't get the same response. And the reason being, and the reason why the outcome is different, is because Sarasota itself was more affluent, had more resources for the kids, and already had more infrastructure for that support. And so you can't expect just to take that model and plop it somewhere else without that infrastructure and get the same thing. So moving on to Texas. First, let me check my time. Actually, I'm wondering if that's part of the culprit. That might be the culprit. All right, just some here. I'm gonna throw it up there. That might be better. All right. Okay, so in 2007, the state of Texas saw a big issue with its foster care system, just like how Florida did. And we just started a really big lawsuit that is still going on today. And so they decided they were going to totally redesign all of foster care in Texas. They called it the foster care redesign. And so they met with foster kids, judges, foster care agencies, and workshopped this over a pretty significant period of time. And they decided to adopt the community-based model, which it is a good model in and of itself, but they decided they didn't want all the messiness that came from privatization. Okay, I feel like my phone is still creating mischief. Is there anybody I can toss this to get it away from the speakers? I'm just gonna set it.
I'm not sure that
I don't.
it's your phone.
It's not?
One of the things is if there's any automatic gain control in the circuit, the farther you move away, the more it tries to get a signal from it.
Oh, so get closer?
Closer could help, and bring that other mic in as well.
Okay.
And let's try that and see if that works better.
All right, thank you. So we decided to redesign it completely, and we decided to mimic basically what privatization was doing, but without actually making it privatized, because we saw the messiness of that. And we created that public-private partnership comprised, again, of CASA volunteers, foster youth, judges, foster care agencies, and the idea was to move away from a profit model. A single source continuum contractor, it's a mouthful, but I'll say a single source continuum contractor would be awarded to basically manage all the services of a particular region. So we talked earlier about how those are enormous geographic regions. Region 3, where we live, is more compact than others because we're in a more population dense area than other parts of Texas, but even then it's still pretty large. I worked in Hunt County and was visiting kids still in region in Ellis County, so that's quite a trek. Encompasses quite a bit of kids. And so we just picked 3 regions where we wanted to roll this out. We picked Region 2, 9, and just one little subsection of our region, Region 3, but really it's just parts of Tarrant County and Johnson County that we picked in ours. And in 2011, the 82nd Texas legislature passed the foster care redesign, where placements were privatized, and those payment structures were radically altered, which is what I was talking about before, where we said, this is the average cost, this is what you have, work with it. Again, this last legislative session, we just said forget it. In the Senate hearings, they admitted this was far more expensive, this doesn't work. But we did try it. We decided that we were going to roll out full privatization in 3 stages: services, placements, and casework. And the pilot program for the foster care redesign began. The agency awarded for the contract in regions 2 and 9, which covers 60 counties in Texas. So that's a pretty good percentage, 60 out of, we have 254 counties in Texas. We awarded 1 contract to Providence Service Corporation, and they ended up terminating their own contract within 18 months because they couldn't develop staff and they couldn't provide the full array of services necessary to keep kids safe. They were given the same amount of money that the state spends for those regions, but it was not sufficient. The state has not been able to find a single source continuum provider to replace Providence Service Corporation. So in regions 2 and 9, they still have no one who wants to bid on this contract. So it's not like there's real competition. We talked about that earlier. That's not how this works. This is not like a free market where it drives on the cost. Nobody wants it, and if they do, they're gonna be the only game in town. So the area of Region 3, again, Tarrant and Johnson, that was part of the pilot program, actually has had pretty good results. It's not all bad. There's an offsuit, so there's a foster care agency called ACH, and they created an offshoot that's called Our Community, Our Kids, OCOK. And they started their pilot. They don't do casework yet, right? They just do placements and services, but they have seen improvements. They're all modest, and they have required a lot more money than the state actually requires as well to do those same services, same as everywhere else. But what they did is they went to their own investors to get that money. They didn't ask the state for it. They raised $6 million on their own to be competitive so that they would have those low startup costs. Why did they do that? Why did they ask investors and all that too. Why did they scrounge together $6 million for this contract that nobody else wants? Well, because for one thing, they're guaranteed to get it, but for two, it means that next time that you renegotiate your contract, you can ask for whatever you want. And in fact, that's what we've seen in other states that privatize. Each time you renegotiate, it's 17% higher. It's always more expensive. You have nowhere else you can go once the state dismantles its own ability to provide these services. And in fact, when you listen to the Texas Senate hearing this last legislative session, last year about it, I listened to, I don't remember if he was the president or CEO of OCOK, but he called that $6 million a strategic investment. That's not a charitable donation, that's a strategic investment. They plan to get that money back, and there's no way to get that money back except for through kids in foster care. And that's not me painting them as boogeymen, that's just using his words. Like, there's just no other way around it. Like, that's not charity, they're gonna make money off of it, that's the goal. And so, there are lots of positives from the redesign, including improved sibling placements together and sibling communication if they're not placed together, and improved preparation for adult living, which is sorely needed. They also came into this, again, that $6 million to spend on building their own software packages that were wonderful and that actually have led to better outcomes. My favorite thing that they've done, though, is Quality Parenting Initiative, where they basically provide special training for different types of kids' needs. So that way it's not just random who you're getting, you've had some training in that specific, whatever that struggle is or whatever that specialty is. That's fantastic. But I argue that the results that we've seen in Tarrant County and Johnson County cannot be extrapolated to the whole state, same as how we can't extrapolate what happens in Sarasota, Florida to the whole state. And the reason being is that ACH is a little bit different. They've been around for 102 years. They're already well connected to their community. This is already a region that has plentiful foster homes. Actually, most of my foster kids were placed in Tarrant County. And so basically what they've done is they made it so other kids can't come in. And so yes, they're having more of their kids placed here, which is wonderful. But they also have a situation where, like, I'm still friends with a lot of my old coworkers and all that, and they're sleeping in the office with kids much more often than they ever did before. More kids are sleeping in the offices now than before we started all this mess. And that's not okay. We actually had a child unfortunately die in Houston not too long ago from that because she was sleeping in the office. They couldn't provide adequate supervision for her there and she left. You also can't get your educational needs met if you're living in an office. And sibling groups are being separated in other areas, not necessarily in this one, because there's not as many homes to go around because they've changed payments and because of all this contract instability. So, there's just more infrastructure in this particular region that if you do the same thing, and even if you use the same software and all those nifty things, you can't expect the same results in Hunt County as you would in Tarrant County. There's just not enough foster homes to make that work. So, and there's just not enough infrastructure and support and services and therapists and other stuff that goes around all the foster care system. So that's another thing. There's no way around it. We have to have more foster adoptive homes. So if any of you have ever thought about that, let me know. I will be happy to help you on that path if that's ever been placed on your heart to do. So even with all of these resources and benefits, ACH still has capacity issues, right? Especially for kids that have the biggest struggles. They have nowhere for them to go. There's no residential treatment centers in that region or anything like that, so they have to send kids with struggles out of their region because they just can't meet their needs, and they really weren't expecting that. It's important to note that as these rollouts have been happening, there's still been no real plan for accountability. There's still confusion about who's even, like, how you testify in court. Anyhow, so who's actually overseeing these contracts, who's managing them, who's auditing them, there's just a breakdown there. The contracts are not really competitive, as we talked about. And another thing I kind of want to dig into is the single source continuum contractors are being given more say over the religious, educational, and medical decisions of the child than the biological families or the children themselves that are being served. So we passed a bill called Texas House Bill 3859, And what that means is, and again, we talked about this single contractor, that's going to be awarded over the, territory, massive geographic region. And we're saying that one agency, if you happen to be religious, can make religious decisions for everybody down the chain. Your subcontracted foster care agencies, your therapists, your schools, all of that. We're giving you that ultimate decision power, and we put nothing in the law that actually gives the biological family any say in that whatsoever, or the kids. And I thought they were supposed to be who we're serving, right? Mm-hmm. And so it's billed as a religious liberty bill, and I'm all for not making Catholic Charities or somebody like that do something they're not comfortable with. I'm not trying to force that. However, there are lots of agencies that are comfortable licensing LGBT families or providing LGBT therapists to kids, or maybe it's not even LGBT, maybe it's a Muslim child who needs to have, a Muslim family to live with that would feel more comfortable that way. Well, I don't think we should be telling those other agencies what they can and cannot do. I think that gets into some real constitutional issues, frankly, and I'd be surprised if there's not major litigation over that in time. But in the meantime, they also can make medical decisions based off children, based on their religious beliefs. And there's really not a whole lot that the child or the biological family can do. The bill says that if the child still wants to have that medical treatment or whatever it is, that, it could be anything, like, it could be anything. It doesn't specify. It didn't say only these services they can't have for religious reasons. It says anything. Anything the foster parent or that agency says that they don't want them to have for religious reasons, they can block that child from receiving. If the child doesn't want that, like if they do want that medical treatment, they can request a new home. Well, that's not a real choice. That's not a choice at all. We talked about the uncertainty and moving, but also bear in mind, if this contractor controls the entire region, then that child would have to leave the entire region of Texas to receive that medical treatment, or to have a different therapist, or whatever the situation may be, or to go to a different school. They would have to leave not just that home or that county, but the entire region of Texas that they were placed in. And that has major implications for whether or not they can still see their siblings if they're placed apart, how those weekly visits with their parents go, or how easy it is for them to attend their own court hearings. Also, just the fact that they may not want to have their entire life uprooted again. That's not a real choice. So, that's kind of how I feel about House Bill 3859. And it'd be so much easier if we just didn't consolidate so much power. CPS would not be monitoring these placements. So who would the child have to talk to if something isn't going right in their home? So you might have a CASA, your guardian ad litem, or you might not. In Collin County, we're fortunate enough to have 100% coverage. Every kid in care has a CASA. That's wonderful. I don't know what the rate is in Dallas, I'm sorry. But I know in other regions it's closer to 50%. So you may not have that independent person you can talk to if something's not right. Everybody has an attorney if you're in foster care. However, I've worked with so many kids who didn't even know they had one, who've been in care 14 years, couldn't pick their attorney out of a lineup, right? So who could they talk to if something's wrong with their foster home who's not an employee of their foster home? That's not a good system for keeping kids safe. The other thing to bear in mind is that single source continuum contractors are not legal parties to the case. So the person who's raising their hand and testifying in court about how the case is going, how the parents and kids are just really taking somebody else's word for it. That doesn't work. Like, I don't see how a court really accepts that. The other situation on that, with them not being a legal party, they can't really be ordered to do anything in the case. So if they're not providing services fast enough or anything like that, right now a judge can tell CPS, hey, get off your butt and go do this. They can't make a contractor do that. They're not a party. So it has all kinds of legal ramifications. But even if all of the above are resolved and everything was working smoothly, and before I want to say that I know lots of people who work in foster care agencies, and these are wonderful people. I'm not trying to disparage them. I'm not trying to implicate them in anything or say that they're not going to do everything they can for these kids. But let's just say that everything above was resolved. You still have a situation where the parents are working a case and the children are experiencing a case, living a case, where they know the people who are making decisions about them are making money for every day that they're there. That's too much. Even if you can see the benefits in some areas or in this and that, giving private companies that kind of power is not okay. It puts too much doubt. They deserve to have an independent party making recommendations to the board. So that's all the notes that I provided. I look forward to hearing your questions and clearing anything up if I can. I hope I can answer all of your questions. But thank you. Yes.
You've listed an awful lot of problems in the foster care system. Are you certain, in your opinion, that taking the kids away from their parents is better than leaving them with their parents?
It depends on the situation. I think that you have to be really careful about that. You can't do that if it's not for their safety. I can tell you that in the cases I've worked, there have been a handful, but not many, bad removals. In most cases, the children's actual physical safety was a primary concern. Yes, yes.
Okay, so you would agree with most of those decisions to remove the kids from their parents?
Okay, so I'm going to put an asterisk over that because I did in the county I worked. I worked in a very different county. I have volunteered in a entirely different county where I would not say that, where I would disagree with most of the ones that I came across. So there's a lot of variability county to county based on the supervisor and the leadership there, because the way the law is written, there's a lot of personal discretion that's made, and the court culture that's there and how the judges think plays into it. So that's a real weakness of the whole system right there.
Okay, I've heard a lot about CPS being involved in child trafficking. Have you seen any evidence of that in the work that you've done?
I have not, no.
I was aware of a case where a mother had a previous issue with drugs, and she had had a child taken by CPS. She later, several years later, had another child, and CPS literally stole the child away from her without even doing any kind of drug evaluation or anything like that. I mean, that maybe that's a little far away from what you dealt with, but do you know anything about situations like that in Texas?
Those do happen in Texas, and those are horrible removals, and that's where you hope that a judge is going to return the child immediately, and it's unfortunate that they would have to go through that.
I'm just curious, how many foster parents just find themselves overwhelmed by a child's problems?
Yeah,
They
so
think they envision, a well-balanced child, and they're just more than that.
well, I think it depends a lot about how experienced the foster parent is, because most of them have experienced a child that overwhelmed them, or they couldn't meet their needs, or whatever the situation was, and they've asked for the child to be removed to a different placement. Most kids have multiple placements, which is, again, that's another one of those traumas of the system that you want to avoid at all possible, and try to prevent that from ever getting to that point. Ideally, what I'd love to see is more investment in mental health and substance abuse treatment before there's a legal intervention, before there's involvement with CPS, so that we can kind of stave some of those off. But yeah, no, those placement changes definitely do happen. How quickly a foster parent does that and how much they try to work with the kid is really individual.
I'm interested in the typical couple, if they time to do this, how many of them are just not prepared? What's the typical kid like? I know there's no such thing as that, but
There's no such thing. That's impossible to answer, because you can be licensed for any different age groups, any different types of therapeutic levels. So there's quite a few people who want to adopt a baby, for example, so they're licensed for, we'd say, 0 to 2 basic level care. And then, that's a very different experience than someone who's taking in, 15, 17-year-olds who've maybe had 10 placements and, a whole different set of complex traumas. So it really just, it's very difficult to kind of say what the typical experience is. It's very variable. Yes, ma'am.
I almost forgot my question. I'm sorry. This endeavor to privatize Why is the state doing that?
Well, that's a good question. I think there's a couple different reasons.
Because they don't want to take care of children.
Because they don't want.
They don't want to take care of, you know, Texas is, do you know where Texas ranks among the states in care of children?
Yeah, we're pretty low. We're near the bottom. The last figure I saw had is like, you know, either 49, 50, but I don't know where we're at as we sit today. And, you know, there's actually another point that I completely, it was on my notes, but forgot to share with you, which is that one of the legislative changes we made was that we've made it even more difficult for biological families and children to sue their foster care providers than we did, then we gave them more immunity than even the state of Texas enjoyed. So if things are not going right, like how, I don't remember which one of you gentlemen were talking about, there's very little recourse. There's even less recourse than there was before. And so I think part of that, and that ties into your question, is that I think liability is part of it. To be frank, like they've been dealing with 7 years of litigation. They've had issues even before that, and so I think kind of washing their hands of it and letting somebody else deal with it takes some of the burden off of the
Washing their
state.
hands of it, that's my thing. Wash their hands of taking care of children of the state.
I think there's some element of that. I also think that they genuinely believe anything would be better than what we're doing, but that's not actually so. We definitely need to have deep, meaningful reforms and change it from the ground. Like I totally believe in that. However, handing it off to somebody else is not inherently a better, more safe system.
Can you give us a ballpark figure of the salary of a child protective worker?
I can give you what it was when I worked there, and I can give you where it is now, and there's a story about why they're so different. So when I worked there, after taxes, and I'd been there, you know, several years at this point, I was taking home about $1,900 a month.
What year was that?
So that was as late as 2013.
Okay.
That's how much Texas cares about the children.
Now they make, if I was to go back to that position, $54,000 a year. So why is there this big difference? Well, there's 2 reasons. One, because as a result of a lawsuit that's still pending, they said, okay, so one of the main issues Texas is facing is this massive turnover. You have to fix that. The one way you have to fix that is by increasing salaries. So we've actually done away with the requirement that you have to have a college degree to be a caseworker. So we've lowered the standards of being a caseworker, but we increased the pay to $54,000. That's a pretty substantial jump. And they also hired more caseworkers to lower the caseloads. That's nice. But part of the reason why it's so high, to be totally frank, and this is just my observation. I've not heard any testimony from the House floor to this effect, but my observation is that because as they talk about privatization, it's clear that a lot of people are going to get the axe. I think they're trying to keep people in their job long enough to not have them look for work now, to hang in there until the bitter end. Because if everyone knows that you're about to lose your job, you're going to start looking for something else now. I think they're trying to keep everybody from jumping off the ship, but that's just my personal opinion.
Is that not part of the court order that Texas has been under?
So I mentioned that that's one way that the judge told them they needed to increase it. They didn't say you need to have it. Well, they're still going back into that's not a resolved issue yet. But the judge did say you have to decrease turnover, and one way that the state tried to decrease turnover was by increasing salary. But they did go, several steps ahead than maybe they needed to. Although I think it's great. I think they deserve it. I believe that $54,000 is absolutely well deserved for that kind of job and those kind of hours, that type of responsibility. Because really think about it, the decisions that caseworker makes has multi-generational impacts.
Yeah.
I mean, what could have a more foundational impact on a child's life than whether or not they get to see their parents again? Like that's big. And I'm sorry, she's got my opinion there.
I had some questions about the nuts and bolts of this House bill.
Yes.
I know that this didn't just materialize. Was this a rider on another bill, or was this bill formulated to create these privatized businesses?
So this was part of a suite of bills that had already passed in previous legislative sessions. It just kind of continued on the trend that was already there. So we had, I believe it was Senate Bill, I think it was 218 from 2007. I don't remember which legislative session that was, but it was the year 2007. And so that was where it started off the process of starting to privatize the services and how we provided those. And then we had in 2011 where we privatized how we did all of our placements. And then 2017 we have Senate Bill 11 where we privatized the casework as well, where it's all just bundled in, all under one company to get all that control under each region, which again, massive.
So to untangle all of that mess, so from what I'm hearing, this was done incrementally and different parts of this structure are within different laws.
Yes.
So what you're describing is a real clustered mess.
We did. We made a big pig's breakfast out of it. Yeah, there's no way around that. And there's some things where we can't totally undo. We just have to try to mitigate the risk. We have to make tweaks and improvements to the system. There are other areas where, frankly, if we can't get contracts of any sorts in some of these regions, it may not be a choice. You may not be able to privatize an area that nobody wants to have a contract in. So I think it would not be unrealistic to see us in the future with a situation like how we have in Nebraska, where regions are privatized and other regions are still managed publicly. I think a mixture is probably what's in our future, to be realistic.
Thank you.
Speak into the mic.
What percentage of the kids come from single parent homes?
I don't have data on that.
Has anyone worked up an algorithm for the process? Now, this may be a strange approach here that I'm suggesting is, but I mean, we have some very good systems management people here in the audience even, who've done a lot of work in the corporate world. It seems that there are some very real challenges to this whole process that probably would be profitable to chart them out, to map them out as far as how things go. And I just want to know, for instance, and I'm getting to the question here. For instance, it seems that part of what is needed here is you need a foster family growing program.
Yes.
But who has worked up something of that nature that you know of?
So it's come through a couple different efforts. One, through Child Protective Services, they have a faith-based initiative program where they try to do outreach to churches and generate interest in their members becoming foster adoptive parents, to mixed results. It's anemic, right? There's no way around it. You can't keep kids in foster care safe if they're not safe homes for them to go to, and enough homes for them to go to for us to be choosy. Because right now we have a situation where kids, stay in homes that maybe if you had more options, that wouldn't be the case. You would kind of phase them out. But where kids are sleeping in the offices, you don't have a whole lot of choice. And I can tell you as a caseworker, when you got a placement for a child, you were given nothing about that home. You were given their name and their address and go. You didn't know if they had ever been investigated for abuse or neglect, because many of them had. You don't know what the disposition of those investigations were when you place a child. You know nothing about it. You were finding out with the child. So it's not like you can even prepare them on the way as to what to expect. It's not that you're just being callous and withholding details. You have nothing. And if you don't like it, then there's not a whole lot of option other than them coming back to the office with you and staying there and not going to school and not doing stuff until you can find something else, if there is anything else, especially if it's dire and the kid has to be placed out of region because there's just so few beds. And so there's no way around it. You have to have more foster homes. You have to put effort into recruiting more. And there are efforts, but they're not totally getting the job done. We can be real about that. And I kind of get to your point about, a lot of people have that worry of how overwhelming is this going to be? Can I handle that? Am I going to have to, how trying is this? And so I think that fear keeps people away. However, I do want to impress upon all of you that the kids I worked with, even the kids with really extreme struggles, were all amazing. Like, they showed more bravery and kindness than most adults can. Even when they're living in hell, they're looking out for the kid next to them and asking how your day is or making stuff for you. They're incredible human beings. And so, yeah, they may have their moments where they're not doing so hot, but would any of us be doing so hot in that situation? Like, we ask incredible things of them. We don't even just, the situation I painted before, now you have to function like a normal person in a setting like this. Like, you're not really given any breathing room for that emotion, and it definitely erupts, but these are amazing kids who are deserving of those placements. Now, I will say, in that same Senate hearing where they discussed this privatization and transition, Senator Don Huffines brought up the idea of having task force in each Texas Senate region for developing a recruitment plan for additional foster homes, and I really support that. However, it never got funded. Nothing actually came of it. It was just kind of a suggestion that was thrown out there, but nothing was written down, and it's just off to the wind. But I would support it if somebody would pick up that effort. I would vote yes on that, should I be elected and all that. Like that, I think that's something that's absolutely needed because, again, there's no way to keep kids in care safe without more homes and to get to be choosy about those homes.
Yes, since the state is still paying quite a bit of money, don't they have still a residual responsibility for all of this? They just can't pass it off to these private companies, right?
Well, ultimately the state is responsible, that is true. However, I think they're putting layers between themselves and that responsibility. They see, at least whenever the rollout is complete, the rollout is not complete yet, right? So no agency in Texas right now actually has been awarded case management responsibilities. They're still in the process of making that happen. But when that happens, they see CPS as being more of a sort of oversight, kind of function where you would pull up someone's case file and audit it randomly, quarterly maybe, not one person's, but like they get every case, every legal case in a region, and they select four out of an entire county that they're going to audit. I don't remember if it's twice a year or what have you, but it's not very often. And so they would thumb through it and study it, they'd have specialists study it and see where they think things went right or wrong or whatever, but they're not laying eyes on the kid or the parents. They're not, you know what I mean? Like, it's still basically taking somebody else's word for it that what's in this case file is real life. So, kind of, to answer your question, like, there's going to be a type of oversight, it's just not a real meaningful one.
So, when the children are up there, then, basically nobody really is monitoring them very well or looking after their welfare. Is that their statement?
I think so. I think that you can hope that the foster care agency is doing that, and you can hope that they have a cost set who visits them and knows how they're doing. If they have one assigned at all, you can hope that they have an active attorney, although that's not often the case. So there's lots of things where maybe things come together and there is more oversight, but there's no real guarantee of that. And for a good many kids in Texas, that just isn't going to be the case.
So was this really and truly a case of cost reduction on the part of the legislature down in Austin? Was that the basic motivation, or was it they just want to wash their hands of the whole thing?
I think there was a lot of motivation. I think they wanted to do something different than what we were doing, and because of the less liability, and initially they thought they would be able to control the cost and cap the cost. They know that's not the case anymore, but I think those things made this an attractive option. I'm not going to say that they put that over well-being. I think they don't have the direct service of these kids necessary to foresee how some of this stuff plays out. I think it looks fine in a presentation by the companies that are pitching it. And I think that they're like, yes, that's got to be better. We've just heard about a child dying for not being investigated here. We know this is happening. Yes, take this. I don't think that they're ambivalent, though. Like, I want to be very clear about that. But I think that they're not really thinking it through entirely.
So what is the nature of this lawsuit? And is it just one lawsuit or are there several?
So it's one massive lawsuit It is part of a larger suite of lawsuits that have happened around the country. There are about 20 different states that this one New York-based child rights advocacy group has started, and but no state has fought it quite as hard as Texas. Most people are like, okay, yeah, fair enough. Let's make some of these changes and whatever. Like they'll fight it a little bit, but Texas is going tooth and nail. And the idea is that children who come through the foster care system are 5 times more likely to have PTSD than a soldier who fought in Afghanistan.
Wow.
Yeah, so there's a lot to take in about that. There's also not, like, you don't know how much of that is because of what brought them into care to begin with and how much of it happened. Like, you're not doing multiple measures on them at various stages of their life, so, you know, you don't know how to tease away some of those effects. But that is a fact. And so we are also a low removal state in Texas, meaning that relative to our population size, we actually remove relatively few kids relative to, well, like say other states. And so our kids have endured more severe abuse when they come into the system. Like that triggers, we have a higher bar for coming into the system than other states. I know it doesn't always seem like it, but we do. And so that PTSD figure can also be a factor of that as well. But the idea is that kids are, they're not being treated well in a lot of the cases. Now, I lay it out like this. Okay, so you said there's lots of systems people here, so maybe there's some stats people here too. So you know normal distribution curve? Okay, so think of it like that. With slightly different tails. I like to think of it as a good 1/4 of the foster parents out there, foster adoptive parents, are amazing human beings. And I say this as someone who's actually had my worldview changed by these folks. I was well aware of abuse and neglect when I started working this job. I experienced it my whole childhood and in my first marriage. I knew about it. I did not know how many people cared. And so 1/4 of the people out there are amazing souls. And I would never say otherwise. Another big chunk of them are better than average, right? Like they want to do right, but they're human, like whatever. Not everyone can be a saint on earth, but they're doing the best they can. I'd say another chunk is maybe a little bit lower than that. They're still providing home and basic needs, but their heart's not really in it. They're over it. But they're going through the motions. Well, okay. And then you have another 1/4 who have no business doing it at all. Yeah, exactly. Some are doing it for the money. You know them when you meet them. And I'm going to finish, and then I'll go ahead and get your question. But so the lawsuit really focused on, you have this big chunk of people who have no business doing this. This is how they've harmed the kids. What are you going to do about the state of Texas? What are you going to do about the kids who can't be seen because of the high, workload and the high turnover and all of that? That's the nature of the lawsuit, is this mess, the whole mess. It's not like a one specific. Okay, I'm sorry. I know you've been waiting for a while.
That's okay. I work for child welfare, so I know there's sexual abuse in these foster homes.
Mm-hmm.
So how is that handled? Who calls? Who calls on the people who are harming these children in the most vulnerable way?
Yes, I've actually had some cases like that as well, unfortunately. And what happens whenever a child in a foster home makes an outcry of sexual abuse or any kind of abuse really, is that then you would call it into the hotline and you would tell, if they reported to me, I would let them know I was their caseworker. That was professional, what you call professional reporter. So if you were a nurse, doctor, teacher, you're all professional reporters at that point. And then they would have somebody from a special, it's not investigation, it's a special type of investigations. It's just for licensed homes that'll go out there and interview the other kids at the home, interview that child, and make a disposition like you would, in another investigation, another type of investigation. And based on that, they would talk to, make a disposition or ruling, and then decide whether or not to close the home, and if everybody else needed a placement or whatever. That's what happens. Sometimes they would just remove that child and keep the home open. I've seen that happen too, which is not okay.
That's criminal.
Yes.
So,
It's a crime. It's
yes.
criminal. Police need to be called in.
In my cases, I've called the police.
Yes.
I'm going to tell you guys something that I found really shocking through my experience I didn't expect. There's no way you're going to come to my desk if you didn't break a law. If you are, you cannot have a child come to me and you not violate the law in some way, and yet almost never was there a criminal conviction.
Wow.
Even when the police were involved, it almost never happens. So that's just, even in the case I'm thinking of, and I don't want to give you the specifics, but it's right there. I did call the police. They did come out and investigate. They knew he was guilty, but they couldn't get all the evidence, and they just let it go. So, unfortunately, especially on sexual abuse is the worst on that. Where even if you go through all those steps, it very rarely actually results in a conviction. And that's a whole other mess to untangle.
In all the churches I've been to for the past 40, 50 years, whatever, I have never heard anyone bring up the issue of protecting children and the kind of stuff you're talking about here. And although you're saying CPS is reaching out to churches and stuff like that, it seems to me that if you could get all of the churches in the state talking about this issue, it would raise the bar on making people aware of it, and aside from the atheists having a hissy fit about it, it would probably bring an application of a huge amount of resources. Churches have a lot of money and a lot of people, and a lot of those people care. I would think if you could get churches actually talking about this and talking about the things that you're talking about tonight, like if you got Prestonwood and maybe a couple other mega churches aware and have them talk about it to their congregation, I mean, maybe you could apply quite a few resources and they could come up with their own money to deal with it.
There are churches talking about it.
Not very many, not the ones I've
North
heard.
Haven United Methodist Church has had huge endeavors. That's where I learned about it.
So different churches have different levels of involvement, and I said that there's a faith-based initiative unit. It's one unit that reaches out to churches throughout the entire region, and I think there's only 2 people on that unit. I've worked with them and done talks at churches to try to generate interest in people being recruited for foster adoptive parents. I've never heard any pushback from atheists or anybody else like that. Everybody I've talked to has been really supportive of children in need of good homes, having them wherever they come from, right? So that's really an important thing to note. But also, I think that we just need more people to spread that message to more and more places. I don't know if Prestonwood's been reached out to. I'm sure,
Well, they got huge resources.
They do, and so I don't know what that communication looked like between that unit and that church or whatever churches, but I don't know how many churches there are in Region 3 at any rate for those 2 people to contact. I have no clue, or how they're prioritizing churches. But I know that is something that the state is
Yeah,
trying
I'm just
to
thinking like if the
access.
governor mentioned it or something like that, and raise that issue up statewide, maybe there'd be a good response.
Well, and I know it's an issue he's talked about a lot throughout 2016. I think that he kind of feels like, okay, we've done something now, so I don't hear him talking about it as much, but Governor Abbott was at least talking about the need for faith communities to be more involved there for a while. I think they're maybe waiting to see how this plays. I have no idea, but I agree. I would love any support that people want to provide.
I'm a former caseworker for the Department of Human Services, AFBC, Medicaid,
Okay.
and food stamps. And I have friends that work for Child Protective Services, and I'm a former teacher. So I don't think people have any idea of what some of these children have gone through, and Texas does not address it, basically. I've been following with that church for some time. Would you say something about Texas Protects, the organization? Texas Protect, do you know something about
I've heard a little bit about them. I don't think I know enough about them to talk about them though. Would you mind filling me in?
Well, they've been in the news for 2 or 3 years now.
Okay.
And when this order came and it was taken over, that who was the court? Which court was it that took over the system and demanded that changes be made? I mean, this was not done by our legislators. They were told they have to do something about this. And people in Dallas, there was a huge outcry over it.
Oh, I remember a little bit more about Texas Protect. sorry, but you probably still remember
There's
it in more
there
detail,
was a
yeah.
huge outcry here in Dallas.
Right, where they gather the data
Yeah,
to look at all the numbers and all of that, yeah.
yeah,
But Texas, we sit in, so many organizations, we sit and talk about this, and then that's the end of it, we don't do anything.
Mhm.
But if you get on Texas Protect's website,
okay,
they keep you updated on legislative actions, and every time something comes up, they'll send you a message telling you the details and telling you how you can address this with your representatives, with your
Wonderful.
state representatives. Texas Protects.
Thank you.
I don't know what the, can you hear me? Average size of a foster care home would be. Would it be like 2 children? Or is there a limit how many children?
There is a limit, yes. There's a limit based on square footage of the home and how many adults that are licensed to care for the children that are in the home. And so, last time I read through minimum standards, and that's a couple hundred pages long, but last time I read through it, it was 1 adult for every 4 children, 6 children, somewhere in that ballpark. I would suspect that they're trying to lower that, and in order for us to accept certain types of funds that have recently been made available, we have to make some adjustments to that as well. But that was the ballpark.
Another question.
Yes, ma'am?
Who's your opponent in House District 67?
My opponent is Jeff Leach.
Okay. Well, we're all gonna vote for you.
Are we,
I don't think any of you are in district. I think only 2 of you are.
But if you do have friends in common, could you give your feelings about Sarah to them, express them about her knowledge and the breadth of her knowledge, please?
And the video we're making.
I think we need to sit down now.
Okay.
Go through no more questions.
All right, great. Thank you so much.
Thank you.
Now it's your turn to talk, so whoever wants to get up here, if it wants to be first, you get for or against what the speakers have to say, come on up here.
uh, everything I know about raising children, I learned from raising kittens. There's a thing called kitty season when all the kittens are born, and trying to find homes for kittens is an incredible task. But more than providing all of the needs for the kittens and actually actively cleaning the cat box, if you don't clean the cat box, they find other places to go. If you've ever dealt with cats, you know you don't really want to discipline them in any harsh sense because they don't understand.
Right.
And so you have to really have an even temper in all dealings and figure out, I mean, if they're tearing things up, you need to find something you don't mind them tearing up. So it's one of the things that can get neglected here is that kittens need a lot of human attention. If you're going to raise those kittens, not to be feral and wild, but if they're actually going to be human companions. And that has to start early and it has to continue. And it makes a great difference in how placeable those kittens are. But then when you are placing the kittens, you find that people are very starry-eyed about having that nice little furry thing in their home until they find out that there are actually requirements that they need doctor's visits, they need shots, they need to be neutered or spayed. Sometimes they need special food. There are all kinds of things that turn up that nobody expected. And you can find people that where you're trying to place a kitten where they just literally go on tilt. And So I would say that in any study of the psychology or just the ambiance of a foster home, I would say it would be an incredible plus to be able to examine if they have pets and how well those pets are treated and cared for. Because I think that's going to be a big indication of the environment that children are coming into.
I don't know that I have a lot to say, but I do want to say that I very much appreciate our speaker tonight and the efforts she's made towards taking care of children. That's certainly not an easy task. But I was thinking all the while she was expressing how difficult it is to even figure out how to deal with all these problems, that, you know, if you could get some millionaires or billionaires, which we have a few of in Texas, to get involved in this problem and maybe develop some kind of, I don't know, pilot program or something like that, but find someone who is very familiar with the problems, like perhaps our speaker tonight, or some people that they could put together, and maybe somebody write a PhD project on how you could deal with this problem and how you could fund it, where they would have the time to speak to the people that are doing this kind of stuff, talk to the families and all that, and actually develop a detailed program with costs associated with things and reasonable and realistic projections of what it would cost and how long it would take and how you could do it. I don't know if somebody's done that, but I would think if you could get some social workers who have been involved in this, who know about it, who are familiar with it, to sit down and pay them to write up an actual program to do this, it might be really helpful to the legislature. I know, just a thought.
The reason I asked about how many kids come from single-family homes, my thought is that we need to, one step before this is the family. I would think we would want to have policies that always strengthen the family.
Yes.
I remember that there's some letters of Lyndon Baines Johnson, how he didn't allow the father to be in the home of welfare families, and as a result it drove the father away, and I think that would be that's a bad idea. We really need to, if our policies are going to be anything, it needs to strengthen the family, and I think perhaps we would have a few less foster kids.
Thank you for coming out and speaking on this topic. This was a very well-prepared presentation. You really took a stand on an issue. This isn't something you threw together last week, and we can all tell that. Thank you very much for taking the time to come out and tell us about this. I knew absolutely nothing about this. I have a lot of strong opinions about how legislation is developed and formed in terms of privatization. I do think a lot of it is licentious. However, I know that something in the state of Texas, we're what, just barely above Slovenia? We really needed something to be done. But this model of governance into privatization, with as much as we have going on in terms of business in our government, I really don't think it was the solution. I think some responsibility in our state and getting those guys off their butts was in the solution. And they didn't seem to want to do that. They just wanted to make it business. And as active as I have been in the campaign and election processes over the years, I can tell you that I've become not necessarily jaded, but very disillusioned by it. I was talking to this gentleman this evening before other people got here, just how disillusioned I've been by all of the empty shirts I've come across on both sides of the aisle over the years. And I wish we had more people like you out there that knew what was going on around them and actually gave a damn about it. Thank you so much for coming out this evening. Thank you.
Yes, I must say that was a very well thought out, very interesting, and a very poignant talk. Because really, the children are our future. And I've seen many cases of what happens when children come from broken homes. It really is a problem, and my favorite topic is socioeconomics. We do have a level of poverty in this country which is astounding and appalling for such a rich country. And of course, the level of poverty causes half the marital strife and so on in homes. So, the first, we have corporations that are trying to drive down the cost of work. I mean, waitresses earning $2.13 an hour is not exactly a living wage, but that's what's mandated. And $7.20, 15 cents, whatever it is also not a living wage. We have many families that just about getting by in Texas. And when you have this level of poverty, it ripples through the whole thing. And of course, the costs to the community actually in the end far outweigh the money that could be spent in making sure the families survive and the children thrive. And that is the most important thing. Now, of course, I grew up during the Second World War in England, but the one thing they took care of was the children. So they made sure the kids were fed, and by and large, they went to state schools and they received a decent education. Now, that simple requirement, I think, doesn't always apply here in Texas. For some reason, they seem to believe that people don't matter. And yet, the bottom line in this world is that really people do matter. And so I hope you have success in your political endeavor. And indeed, I think you're up against a lot of cultural sort of bedrock there that mitigates against anything that the state can do or want to do. This privatization craze, we've seen it in England, led by Thatcher, and it's led to disaster after disaster after disaster. In fact, the critical thing that's happened when they privatized things like London Airport and schools, they're not run by the state in England anymore, but they're run by the state, the German state, or the French state, or the Spanish state, apparently. That's basically what's happened. And of course, a few people make a ton of money, but by and large, of course, they reduce the service. Because as Lenny said, the budget's cut because apparently the aim of this is we'll have a businessman run it and therefore it'll be much more efficient. Well, not when he's lining his pockets and his mates' pockets, it's not. And it's because he's hiring usually the lowest paid people with the fewest qualifications. So it's a recipe for disaster. And basically it's come home in England. Carillion was a huge privatized outfit that was doing school meals and who knows what. And because of the austerity in Britain, it went broke. So it all came back to the government. So this notion that, now, of course, you have to go back to the legislator. Are these people fit to legislate, actually? And many times they're not. We don't have a Nicole politique as the French do. We actually train bureaucrats to do jobs properly. And I think when you look at the disaster that's gone on, that's probably would help a lot. But in such a rich country, you'd think it would be possible, right?
Thank you for your presentation. I wish I could, you painted a nice picture of our legislators. I don't believe that it is a nice picture. I think it's a really ugly picture. And like I say, I've been following this for some time, and there are lots and lots and lots of people who care about this. And when the court order came up, there was a huge outcry in Dallas, and I can't believe that that people haven't heard of this. You know, do you read the papers? Do you listen to television? It was all over the place. And the school, I attended the School of Social Work in Arlington. I had 32 graduate hours in social work. And there are lots of people that really care about this, not Texas legislators. Dan Patrick and Governor Abbott would not even listen, even under court order. They would not even listen to the social workers that have studied this and know what they're talking about. What did they bring up? Bathroom issues. Nobody in the state has ever been assaulted by a transgender person in the bathroom. Nobody. Yeah, and children at that time were dying. I think there were 7 or 8 children that died in Texas. Do you know?
I don't know, but
A few years ago, the children were actually dying, and they wouldn't even talk to the social workers about this. And when you get to the legislature, it's Dan Patrick. Dan Patrick is the one. He would say goofy things to them. He would do everything under the sun, but he would not listen to the social work community and the psychological community, the people who do study this. And as citizens, you know, we can shake our heads, or we can keep informed, keep updated. Privatization, I am not for. The goal of privatization is to make money. And we've seen this time and again in the prison system. You know, the prisons had lots of problems in Texas with privatization, and were not tending to the needs of the prisoners. There were lots of contraband and officers being shot, and that's why the former administration was going to close down these organizations. They were not employing people from the community to help. They were taking the government's money, but they were not employing any of the community. And they are currently having the immigrants who go, the refugees and immigrants who get sentenced to these private prisons. They're doing the labor now, and the ACLU has a lawsuit now against these prisons in Texas because they're making the prisoners do the work, the maintenance and everything, pay them $1 a day. So I'm not for privatization. It's what's the saying? A nation is judged by how they treat the most vulnerable citizens. And these are the children and the seniors and the sick. And Texas is down the bottom. Texas is not that poor. I mean, Texas is not a poor state. We're not the richest state, but we're not a poor state, and we consistently stay down in the bottom in taking care of these needs. I heard a speaker recently, he was a former with the Department of Education, I believe. He's written a book, and he said we can say, oh, we care about the children, we care about the children. But that is a myth. We do not care about the children, we care about guns. When guns come up, people hit the streets. Money changes hands, all this happens. When it comes to children, we say, oh, we need to do this, we need to do that, but we don't do it. So that is not a rosy picture, and that is the state of the situation.
I believe if I was in trouble as a kid, my Aunt Adele would have taken me, my Aunt Lil would have taken me, my Uncle Frank would have taken my you know, if I had, you know, I just would have had this interlocking support group of families would have taken me. And so what are we saying about these kids? We're saying their grandparents don't want them, their older siblings don't want them, their aunts and uncles don't want them, and I would wager to say no one in this room has a foster child and wants them. So I think we have to be very careful when we start saying, you know, I'm all for the children, and I think the state should take care of them. That's very easy to say, but remember, you know, people live their lives, they raise their kids, they've got a few years left before they die, and to ask them to take these kids on is asking a lot. So, I mean, I always hate it when we reflexively go, I'm a great guy, and so I want the state to take care of this problem. Sometimes we have to say, we need to be a strong society and we need to take care of ourselves. If my nieces and nephews were in trouble, I would come to their aid. I think it's very important to recognize that we have a society that I think is breaking down. And this is really something more of a symptom. And we need to recognize that, you know, we're not taking these kids in either, you know, anybody, I'm not, you know. So, just to say the state should do it, that's all nice and easy, but I'm not sure if that's fair necessarily.
I'm never saying that.
I'd like to thank you for your presentation. It was something that we need to hear. I've listened to the comments that others have made, and I'm not anti-church. I go to church, and I'm very much involved in churches. But churches don't do what they ought to do. The one that I go to doesn't, and the ones that I've been to doesn't. The churches look down on children sometime and blame the children. The children didn't bring themselves here. Parents did. And we recognized during the last depression in 1929, there were some things beyond the reach of people. And that's why we created these programs to help people. It wasn't designed to last forever, but it has, because we didn't empower the people to do for themselves. And that's what we need to do. The state, the churches, if all of them put the money they have left from when they buy everything they want to buy, it wouldn't be enough to take care of that. The state is the last resort. And I feel the same way about privatization. It's just to fatten someone's pocket and mistreat the children. And we as a state, we don't want people to have family planning. We don't want people to have abortion. And then the children are born and they get further messed up in the foster care program. It's no excuse for that. We need to take care of the children, and we do it if the state does it. We pay the taxes. It's not the state don't have any money that they tax us for. And I think people are willing to, some people are, but they don't, a lot of people think that, you know, they did some kind of sin or something their parents did, and some parents do things wrong for their children. But if a society that pretends to be humanistic and want to treat everybody right the way most of them, the Bible said, like someone has said before, we should do for the least of us. And really, Texas in general is not a poor state, but a large segment of people who work in Texas are, because of the minimum wage law. They don't make enough. And it's, I don't know, it's unfortunate, it's even that the poor have more children and they're less able to take care of them. And we have a system now that's different. Used to, where I grew up, you had large extended families. And if something happened, they would take care of them. But now many people are away from their families. They're in a city by themselves. And there's nobody else to do it. And, you know, we raised 3 children. And if I had grandchildren, I would look after them. But I don't think I would go beyond that, because raising children is not an easy job. I enjoyed it, watching them growing up. I want them to stay babies, my daughters particularly, forever, but they grew up and they're very grown now, and I'm by myself. But we need to think about the attitude of Texas. And I think that the gentlemen, the Governor Abbott and Patton and Payton and those people, they don't care nothing about nobody but rich people. And if we wake up and get beyond the peripheral issues that divide us and do what's right, I think things would change. But until we wake up, it's not going to change. Thank you.
Again, thank you for your presentation. I really trust legislators who are going to be like you, who actually are people who have served to really care about other people. You know, if we're going to solve this problem, it requires birth control and having sex education in the schools and teaching young people about family planning, and also teaching young people how to pick a marital partner, because so many of these people get with other dysfunctional people and they don't have the background to know how to cope. But if we had parenting classes that children were involved in as they're growing up, they would have a better understanding what's involved. So, it's more complicated than that, and like John said, it's economics. As 90% of the wealth that is created goes to the top 10%, we're going to have more and more dysfunction because people can't handle the stress of no finances and then dealing with children. But anyway, the first priority has to be that people who have developmental specialties should be making these laws, because otherwise they don't understand the repercussions. No child should ever be handed over to somebody that child does not know. That is immoral. And there's got to be somebody that the parent, because these people probably a percentage of them, somebody goes to the home and they intervene, but they're maybe not taking the child away with the first contact, I don't know. But that's when, anytime there's a contact, then a parenting plan should be established, so they say, look, if we have to come in, who are the people that we need to have contact with? Who are the people in the community? And I'm totally with the faith-based community, that the child should be mandatory that they stay in their own schools. We have kids being thrown all over this state, and they need to be with people that they know. And so I think all the churches or synagogues or whatever should have foster care requirements, that they become foster care communities, where when a young family says, oh, I have a whole group of other people that we meet with on a monthly basis and we're all potentially going to be foster parents, then that child goes into a community with lots of resources.
Amen.
The other thing that happens that some people may not be aware of is that when kids turn 18, a lot of these families kick them out, and that may be the 25%, the lower 25% who say, I'm doing this for the money. And so not only does that child lose any financial base, but they also lose that concept that they may may have thought somebody genuinely cared about them. So I think they should be required to be part of the system until age 22, so that they have equal footing, and they shouldn't be placed in families where there are children, because these children have been abused on a lot of different levels, and they're going to act out that abuse. And so people just really, I know there are not a lot of family fosters yet, but hopefully we can groom society that this is a major need. So anyway, I appreciate your efforts, and I hope we can get this changed.
One of the things I think that is rather obvious that we don't want to look at, and we would like to have some kind of ideal outcome, but this problem is not going to get solved. There are way too many aspects of it that are just uncontrollable by anything but, almost like a moon project or something that NASA would be engaged in. I mean, it would have to almost be at that level to get the problem really solved. But that doesn't mean that we don't need to do the best job we can with all the resources we can manage this with. And so it's a complex situation where you're not going to be dealing with everything. But then how can you improve what you are able to do? And that to me really looks like the challenge that you have. You brought up Nebraska as an example, and Nebraska has a lot of history of child abuse.
Yeah.
And you've got Father Flanagan's boys' home there. I did interviews of a former Nebraska state senator, Attorney John DeCamp, related to the Franklin cover-up and the active trafficking of children into pedophilia, and a large pedophile network which never really got cleaned up there in Nebraska. And I have to presume that it even wasn't cleaned up quietly. I mean, you did have some people relocate. In 1997, October of 97, former LAPD FBI chief Ted Gunderson asked me if I would go videotape a conference in Atlanta. And I learned at that conference that the former Omaha police chief, Bob Wadman, who'd been identified by many of the children, was actually now in Atlanta and had a position in the local police there in Atlanta. That conference was the CT Expo on ritual abuse, child abuse, mind control. I could tell you some stories from victims reporting there that you'd literally lose your dinner. I mean, it was that traumatic, that severe, and I have some kind of jokes about it. The conference was put on by Sylvia Gillott, the attorney ad litem for the state of South Carolina dealing with ritual trauma cases. Ritual trauma and child abuse. I mean, South Carolina actually had an office there of an attorney ad litem dealing with cases. And so we're getting reports there. Well, I came in and my first experience, I didn't know what a CT Expo was or anything like that. I walk in early because I've got to set up for the conference, and I've got jet lag, everything. And I'm going to get a little bit of breakfast, and I gotta kind of do a double take because an entire SWAT team in full regalia walks up behind me there at the little McDonald's or whatever it was. And I'm like, what the heck? I mean, who are they after here? I mean, what's going down? Turns out it's a SWAT team conference. Counterterrorism Expo. Now, this is the kind of backup that Sylvia Gillot felt was needed for these people to tell their stories. I mean, it was that severe that they were expecting potential reprisals from victimizers with people coming out with their stories. And so she had it scheduled. It was on the 22nd floor of an old hotel, and it was in the Monte Carlo room, and I'm going around there, and I went up to Sylvia. I said, Sylvia, I've been scouting around here, and you're actually holding your conference in a former ritual trauma site. And I gave her some of the evidence of that, and she said, well, no place is perfect. Just don't tell anybody. But there is really severe organized harm being done to children on a very high level. You would think this is lower classes that are doing this, and in fact, you find out that it's not always so. And that the interesting thing, I mean, when I started getting into this kind of research, I started getting ulcers. I mean, it was very deeply upsetting. And so it's kind of like, what do you do about it? Well, I actually got on the trail, and we got evidence which I was hoping was going to put Lieutenant Colonel Michael Aquino in jail for a long time, because it was a kidnapping murder case where there were witnesses who'd seen him involved. And so I'm out in San Jose, California, trying to get the witnesses' testimony, get it on tape so it's preserved. The person working with me, who was the interface, screwed things up. He convinced the witness to go to the DA and give his story before we got our story. The DA charged him with complicity, locked him up on a 10-year sentence, and refused to charge Aquino.
Wow.
And this is what you find time and again, is these people at the top, whether it's in military or in government, they are Teflon. The judges, whether they're giving Masonic handshakes or whatever club or whatever it is they belong to, they skate and the children suffer. So any program that has to do with CPS, by the way, I did hear that CPS had lost, I don't know if you can verify or thumbs up or thumbs down on this, but they're saying CPS lost 2,000 children over some time period here in Texas.
Well, I've seen that.
You can answer that when you get back up. You can give us a good answer then. I don't know that it's accurate, but I mean, that to me points to the very disturbing fact is any system we have that is dealing with children in this way has to have comprehensive oversight. It's got to have more oversight than you've ever seen. I mean, we're in a surveillance society, and the interesting thing is the parties who should be being surveilled, like our elected public officials, no, all the surveillance is on us, the private citizens, and it's not on anybody who it needs to be on. But we have all the equipment to do it.
Anyone else? I guess I'm the last one standing. Anyway, I want to thank our speaker for doing a great job here tonight. Got us all thinking. Brought up some things that people don't think about, which is very important. What I'm looking at, listen to John here, as far as economics being the basics of all of this. In Texas, why is Texas in the worst position for taking care of children? And I think the answer is that the adults are not paid as well as other states. If you analyze that, we don't. We have a great deal of our minimum wage is low. We're a right to work state. It's a right to work for less, by the way, and that's happened. And as a result, corporations all want to come here because the labor costs are cheaper, and that's why they're here. And that's why you have this prognosis of corporate greed, shall we say. And that's not a good thing. So I think that we need to, when you get to the state legislature, I say when you get there, and you will, because we're all for you. And you need to think about raising the minimum wage in this state so more people would be able to take care of their kids. And if you eliminate some of the stress in the family, you'll eliminate a lot of the problems you have with child welfare, etc. Anyway, I better shut up while I'm ahead and give this back to you.
Well, first, I want to thank all of you for listening so attentively and being so interested in this topic. I know it hasn't directly impacted many of you, but yet you still have compassion and care and you want the absolute best for these kids. And so I want to thank you for being here and for your curious minds, because do you guys come here every week, you said?
Yes.
Okay, so yeah, you're lifelong learners then, right? So wonderful. I don't remember everything that was brought up, but I want to touch on a few that, see what I can do to kind of help out with what I know about the causes of why is Texas why are our outcomes so poor compared to other states? And poverty is a factor of that. We actually do have more poverty in Texas than in other states. And so that is a factor. Some part of it is also that we have more, how do you word this? The way our highways are done, we end up having more areas where there's more trafficking and drugs being brought in than some other states. Not all, but there are definitely regions of Texas where those are real hotbeds of illicit trade, we'll say. So that is a factor. Another factor in Texas is, unfortunately, we invest very little in prevention services. It's very difficult for a family who knows that there's a problem, maybe wants to get help. It's very difficult for them to access that help, especially if you're in an outlying county. Most of my work was in Hunt County, and if you wanted to go get real drug treatment, if you needed a bed, you're going to drive all the way to Dallas or Fort Worth, and if they're out, well then, okay, and because there are so few beds available for treatment, I'd have parents who wanted to be clean who were having to continue to use so that they still met the eligibility requirements for those beds whenever they came up. And so there's no way around it. We have to prevent kids from coming into care by providing help before things get totally out of control. And that would be helpful, not just on the child welfare side, but on the criminal justice side as well. And so, expanding access to drug courts and that sort of thing, as opposed to locking up parents, letting them, stay where they can get treatment and still be part of a family unit, I think is an important thing that would reduce the amount of kids that come into our system. You asked about kids that had gone missing. I don't know if we're thinking of the same thing. I know of a case where about 1,400 kids have gone missing, but it wasn't through the state's child welfare system, it was actually through the state's immigration system, where children were placed but never came back to their hearing or whatever, where they just kind of got scattered to the winds. And for about 800 of them, we know that we actually handed them over to traffickers directly. So not a great outcome there. Absolutely not. We need to have better record keeping and more vetting, make sure that we're actually handing kids to the right people. So I'm trying to think of what else was said that I should be addressing right now. There was a lot. Okay, so I have information on the back. I know I've forgotten several of your questions, and I apologize for that. Please do reach out and contact me if there's anything you do want me to talk about, or, is something that I didn't answer here that you think of later. I'd be more than happy to talk to you. So just feel free to email me or what have you. It'll be me that responds. But again, I really want to thank you for this invitation and for listening so attentively and for your concern about this issue. Thank you.
Well, that's the end of our formal meeting for tonight. They kick us out of here at 10:30. Our speaker's here if you want to talk to her, and so but our formal meeting's over. So thank you.